All right, today we're going to dive into the science behind a really important medication for Parkinson's disease, Rasagiline. We're going to explore how this clever drug works, not by adding something new to the brain, but by protecting what's already there.
You know, the huge challenge in Parkinson's is the loss of dopamine. But what if the best strategy wasn't just about replacing it? What if we could actually help the brain hold on to its own supply? That question, right there, is the key to understanding everything about how Rasagiline works.
So, to really get the solution, we have to start with the problem itself. And it all boils down to one single vital chemical messenger in the brain. At its heart, Parkinson's is all about the loss of brain cells that make dopamine. You can think of dopamine as the oil that keeps all the machinery of our movement running nice and smooth. When that oil level starts to drop, the whole system just starts to get stiff, slow, and shaky. Okay, so if the problem is a lack of dopamine, how do you fix it? This is where Rasagiline comes into the picture with a really smart approach. See, Rasagiline doesn't try to add new dopamine into the brain. Instead, it acts more like a protector or a facilitator. It's designed to preserve and boost the effect of the dopamine that the brain is still making on its own. It's a strategy that's all about conservation and efficiency. So how does it actually do that? How does it protect that dopamine? Let's get into the mechanics, which are actually pretty elegant when you see them in action. So, the body has these two types of cleanup enzymes called MAO. Think of MAOA as the general cleanup crew. It works all over the body, cleaning up all sorts of things. But MAO-B, now that's the dopamine specialist. It works almost exclusively inside the brain, and its main job is to break down dopamine. Rasagiline's real power is its precision. It goes right after that specialist. So here's how it plays out. First, dopamine gets released to send a signal for movement. Then, that dopamine specialist, MAO-B, shows up to clean it up and end the signal. But Rasagiline steps in and basically tells MAO-B to take a permanent vacation. It just blocks it. And the result? The dopamine gets to stick around longer, its signal is stronger, and those movement symptoms can start to improve. Now, the key word here is irreversible. This is so important. Rasagiline doesn't just hit the pause button on that MAO-B enzyme. It completely deactivates it. It's like a key that breaks off in the lock. That enzyme is totally out of commission until the body can build a brand new one, which takes about 2 weeks. And this is where the story gets even more fascinating. Beyond just helping with symptoms, some lab studies are suggesting that Rasagiline might actually be neuroprotective, that it could help shield those dopamine neurons from getting damaged further. Now, to be clear, this is not yet proven in humans, but the possibility of slowing the disease itself, well, that's an incredibly exciting frontier for researchers.
Okay, so with all that science in mind, let's switch gears and look at how doctors actually use Rasagiline as a practical tool to treat Parkinson's in the real world.
Rasagiline is really versatile. In the early stages, a doctor might prescribe it all by itself to help control symptoms, and it has a low risk of causing those involuntary, jerky movements called dyskinesias. Then later on, when patients are on the powerhouse drug levodopa, Rasagiline can be added on to help reduce off periods. You know, those times when symptoms come back between doses. And one of its biggest advantages is just how simple it is. It's just one dose, once a day. That's it. So let's just pull it all together. What are the key advantages? Well, you get effective symptom control. It helps smooth out levodopa treatment by reducing off time. It has a low risk of dyskinesias when it's used alone. It's super convenient to take, and it holds that exciting potential to maybe, just maybe, modify the disease itself. Okay, let's shift gears now to what is, without a doubt, the most important part of this explainer. Understanding how to use Rasagiline safely is absolutely non-negotiable, and it all comes down to interactions. So you might have heard of something called the cheese reaction when people talk about this class of drugs. It's kind of this old historical term for a really dangerous spike in blood pressure that's caused by eating foods rich in a substance called tyramine. And here is the really good news. Because Rasagiline is so selective, it only goes after that MAO-B enzyme. This reaction is very rare at standard doses. The advice isn't a strict never eat these things. It's more of a heads up to avoid eating very large quantities of stuff like aged cheeses, salami, or sauerkraut. For most people, a normal diet is totally fine. But the most critical issue, and you really need to listen to this, is drug interactions. This is essential. Taking Rasagiline with another MAOI or the painkiller mepridine is an absolute no-go. Forbidden. There's also a very high risk when you combine it with common antidepressants, tramadol, or even over-the-counter cough syrup that has dextromethorphan. These combinations can cause something called serotonin syndrome, which is a potentially life-threatening overload of serotonin in the brain. So the single most important point is this: your complete list of medications, and that includes over-the-counter drugs, supplements, everything. That list is the most critical safety tool you have. You must always share it with your doctor and your pharmacist before you start Rasagiline. Okay, let's bring it all together. What have we learned? Rasagiline is a very smart medication that helps the brain hold on to its own dopamine. It's a flexible tool that helps control symptoms in both early and later stage Parkinson's, and it's easy to take. But, and this is the big one, its powerful mechanism means that managing drug interactions with extreme care is the absolute key to using it safely. Which leaves us with a final thought to chew on. We've seen how Rasagiline works to manage symptoms, and how it might even offer some protection. It really makes you wonder, what's next? What does the future hold for therapies that don't just treat the disease, but actively protect the brain from its progression? That question is exactly what's driving research forward every single day.